Hi, my name is Marcia Bushell. I'm a dental hygienist. I am taking a teaching methods class for certification purposes. My husband is videotaping me with one of my classes today. This is a team-taught class. It's called Dental Pain Management. We are at Milwaukee Area Technical College. This is our health occupations building that was built in 1996. We are in the pre-clinic area. There are 16 cubes here that have individual chairs set up. This is where the students practice. They actually practice on mannequins and they practice on each other. Today this is a dental pain management class. We will be showing the students a particular injection today. And I want to just go through the details on how we go about doing that. First of all, the students have had 8 weeks of lecture before they end up in the pre-clinic area. I am not responsible for the lecture. Part of this course, I do help in the clinic only. The students have learned how to inject a hot dog, which interestingly feels very similar to human tissue in the mouth. They've also had 2 classes here in the pre-clinic area where we have helped them with their injections. They learn a total of 12 different injections, 6 on the upper arch and 6 on the lower. Today we are doing one of the ones on the lower. This is the injection that most dental patients are most familiar with because it leaves your lower face feeling numb. And if you are old enough to remember Bill Cosby, it is the injection that he did the routine on where he had a face that he felt was drooping and he felt he was drooling all over the place and he couldn't talk. And that's the injection that we're talking about and showing and having the students do on each other today. We use a textbook. Our textbook has great diagrams and pictures in it, and also details on how to go about giving an injection. This happens to be a textbook that is used nationally by not only dental hygienists, but also oral surgeons and every dental occupation in between. We also give the students a graph that they can fill out. My particular one is messy with my own notes. It's also laminated so I can take it into clinic and wipe it off so it stays relatively clean. The students are encouraged to fill out their own graph however they want to and to have it as a ready reference. The next thing that we can use to help the students see a little bit easier, so they can see where their target areas are. This particular injection, their target area, there's a little foramen or a hole right there that the nerve runs through. That's
angle of approach is above the premolar and then about half the carpule. Pull out a little bit, reposition, aspirate, deliver some more, so we do the lingual.
right.
About a quarter of the carpule at that. And isn't it an aspiration again? And then we can draw out.
I like
we'll
to,
do
I like to aspirate at the end
and
too.
we'll do the long buckle.
Right, right. Long buckle is right there. And you're not going to be...
Minus
They have wisdoms.
No.
Alright. I wasn't too bad on my I wasn't too bad. The gap off the wheel and try to draw just a little bit.
Okay.
Okay, good. And then just do some so that you're going to pick it up and that. how those contagions are. Yep. Did you?
Yeah.
And we're right where we're supposed to be.
Oh, yeah, it was weird.
Yes.
Well, thanks for not jumping. Thanks a lot, right?
Very.
Number 9.
Yeah, you can do that. That's fine. That looks great. Doesn't look awkward either. And then once you get the syringe where you... Corey's really numb. Corey's really numb. What I was just asking these guys here is what they learned today that is new from last week.
I said what it means, that what the actual bevel to the bone means. When I'm looking at the needle and how you get that little dribble of the anesthetic, and I'm like, oh, that's how we're going to deliver. And then you can see why that makes sense. It flipped in the brain.
Okay. A light bulb went on.
Yes. It's gone bright.
You guys?
No, she waited on that side.
You feel like you're Cosby.
Like,
Now, just imagine if you had 4 times that amount of anesthesia. How numb you'd be.
I am.
But could you feel better about things? Okay, Amy, you're too quiet.
Amy, we're going to get Amy now one of these weeks. She's got special.
If you have like third molar impacted, aim a little higher. Higher. You pull it.
Yes. Great.
So when they sit up, it goes into the foramen.
Right. Sometimes I think, when you're retracting and you think like, oh, they have impacted, we want to, sometimes I think our comfort zone is that little triangle where it's soft, but then you have to think, now what's under there in relation to where's the nerve? And that's why you're aiming a little higher. Aim high.